Yeah, my father founded this lab where we work now about 40 years ago. It was the year when I was born, and now we are 8 dental technicians here. We are 3 dental technician masters and 5 dental technicians. We do the whole dental technician work in our lab, except orthodontics. So we really do a lot, all ceramic. It's about 80% in our lab with zirconium dioxide and some pressable ceramics. And we have a little bit PFM, which we do with Syntron in our lab and our machines. That you all know where we are with our lab. I made a little video for you, and we start in the USA, fly over the Great Lake, and off to Europe, to Germany, in the south of Germany, and this is about half an hour south of Stuttgart. You may know Stuttgart from football and Porsche and all the Mercedes-Benz we produce there. And half an hour away from Stuttgart, there's my lab. It's actually this building here, and we are here now since 20 years. It's located in an industrial area on the outskirts of Pfullingen. The Swabian Alb is right behind my lab. That's where the Swabian Alb starts. Here are the little mountains here, and it's about a 500-meter hills, and I love it to go mountain biking right after work. When we finished work, we can do there some sport, and it's a good work-life balance, I think. A nice place to live. This is the lab. We are in the whole upper and lower floor. So this is the working benches for all of us. We have each technician has 2 working places, one for grinding, the other for modulating. This is the ceramic and composite room. Actually, here I'm sitting on this chair now and showing you what I do with the Zolid. And also we have a chair here in this edge of the room where we can take the tooth color and make some try-ins with dentists in the lab. So this is really good and a very efficient workflow. If we can work directly on the patient and then go directly in the oven and fire it. That's the chair here, and opposite are the ovens. And one very important machine here in my lab is the espresso machine here in the edge. I drink a lot of them. So we have 4 digital working places with MAP 400 and MAP 600s, and we do a lot of our workflow digital. I learned this all in an analog way about 20 years ago, but now we're going more and more in the digital way because it's so much more efficient and we can work more precise and we have the same result like every day. So here's another scanner, and from this working place you can see some of our machines. This is the youngest baby. It's the Nextend from 3D Systems printer 5100. You will see some cases with printed models in the next half hour. And these are my motions. We started with here's a motion 1, here's a motion 2, motion 2 DNA, and the printer, the light curing unit here. And that's our machine park, but it's not the way it always had been. This is actually the first machine we have had in our lab, as we started with zirconium dioxide about 12 years ago. It's 2006. We had a copy mill, and with this copy mill we copied these hand builded copings and milled them. And as you all know, when you do something by hand, it's not the same result in every day. So after we milled a few of them by hand, we started to do it digital. And you all see the motion 1, it still works, we still use it. And in the beginning we had one material, And this is the material which is available now. You all know Ceramil's solid pre-shade will not be longer produced because we have an even better material. Instead of the solid pre-shade, it's the solid HT+. I do a lot of work with HT+, which you can see in the following slides. And as it all started with one material called Ceramil ZE White, now we have huge blanks. We have still ZE, HT+, FX, and we have FX and HT+ in pre-shade and in white and in solid FX in multi-layer. So we have huge ways to solve a case, and in the next slides I will I hope I can show you how I decide which material I take in the case I have to do. So I start with a single crown, and then we go more and more until we have some 28 crowns. I brought some really big cases also with you, but let's start with a single crown. This is a full digital workflow I did with the university in Tübingen with a 3-shape Trios 3 scanner, an intraoral scan, which I built a model in the Ceramil Mind. And as this case is 2 years old, we milled the model. Nowadays I print this, but the workflow is almost the same. So we do a full contour setup of this central tooth. We copy this one digital and mirror it to the other side, and then do a little bit of labial shrinking, about 0.5 millimeters, that we have a little bit space for our layering technique to make a nice crown. So this is the milled model with a motion 2 DNA, and here's the crown, and we made a try-in in the lab, and this is the crown you see now. So this is solid FX multi-layer with a little bit of Creation ZE CT on the labial side, about 0.5 millimeters, and this gives us on a vital die, which is not discolored, a very good opportunity to copy a natural tooth. So this is try-in. Patient wanted a little bit of diastema in the middle because he has had that before he lost the tooth. So we reduced the finished crown a little bit on the mesial side because he wanted this little gap, and that's his smile now, and he's super happy, and that's possible with a digital workflow. So no impression, no physical impression, just the digital one, and we got to this result. Very nice fitting and perfect happy patient. So first case is finished. We directly move to the next case, a little bit longer, a little bit bigger one. It's a 3-unit posterior bridge with solid FX multi-layer. My buddy Michael from Fullingen, it's my town here where I live, he has his office in Fullingen too, and we work a lot. And this is a case I want to show you a few things. We all have these patients that do a little bit of grate with the teeth, so the bite gets lower and lower every day. So in some days the bite is so low that the crowns, after they are preparated, are not that high. And in these cases, my buddy Michael preparates these ridges in the preparation to have more stability for the bridge on the preparated tooth. So this is very important, and there will be a preparation set in the near future to get nice and smooth preparations like this. That's the impression of this preparated tooth with a pontic here in the middle, and I make a model in my lab. We work with the Chiroform model, so we can make a good model management and a good occlusal before we start. And I don't start with these cases before I have an occlusal concept in my model, like it's in the mouth. So I get the information from my dog, it's an occlusal protocol, which tooth has contact in the mouth, and I work on my models until I have the same on my model, because that's the main thing why some dentists have to grind on our work if the model work isn't perfect. And Giroform allows me to work this very precise. So I designed a full contour bridge out of Zolid FX. The material is open for this 3-unit bridge in posterior, and as you all see, there was not a lot space, and so I don't want to put some layer of ceramic on it, because you all know it's a lot weaker if we reduce this and put some glass ceramic on it. So we want the strength and the aesthetic of this full contour zirconium dioxide. And the machine does a very nice milling with a HD strategy, and we have a nice occlusal relief. And then we do some color on it, and we do some glaze paste on it, and we get to this result with not much trouble. So this works very easy. Everyone can do it in the lab. It's nice to control and nice to work. And this is the big benefit of this preparation. As you all see, the dye is very low, so there is not a lot retention for these crowns. And as the dentists don't want to bond these bridges by adhesive techniques, they want to cementate it with a glass ionomer cement, because it's so much better to remove all the cement. It's very important that the bridge is really strong on the preparated dye, and these ridges where you have seen with the prep set, these little curves under there allow that the bridge is sitting really strong on these dyes, and the dentist can cement it good in. And this is 5 minutes after cementation, after polishing here the margins, and you see the nice color and the nice shape and the occlusal relief in the mouth. And we don't have to layer for an result like this. It looks natural, and this is Zolid FX multi-layer with stain and glaze. Okay, we finished the second case, so I have another case for you. This is a little bit bigger case. It's 4 units of front tooth restoration with the University of Tübingen and Dr. Andrea Klink, which is the assistant medical director there. It's a very interesting case because if we do some front tooth and there are crown next to veneer, it's always difficult to get a nice shade match. And I want to show you that it's possible to do this with not so much trouble when you all do it with zirconium dioxide, like in this case. Okay, this is the beginning. The patient had a really bad accident with a bicycle. He broke his lower jaw. That's where you can see is fixed with some screws and titanium plate here. And he lost his tooth number 11. Here in Germany it's 11. In USA it's called, I think, 8. And it was lying on the ground, and they put it in again. And he got some splint, and they fixed the lower jaw with the upper jaw with this material here. So it's really a hard case. And after this all healed, the dentist made some composite fillings here on the front tooth, but the patient was not happy with this, so he decided to do it good with some crowns. The problem in this case is that the replantated tooth number 8, this one here, the central right front tooth, has another emergence profile, but the patient, when he laughs, doesn't show this area. So we decided not to do here some operations with gum. So we decided to leave it like that. Preparation was not done before we did the planning. So we did with the M-Smile tool, we planned this case and decided to do one veneer and 3 crowns. After that, Andrea made the preparation of the teeth. So these are the crowns, and you all see this veneer, and it's kind of hard to do this with different materials. So if you choose like lithium disilicate, in this case, it's hard because there is nearly not a lot preparation here, and I don't think it will work with Emax in this case, but Emax would be great for the veneer. And we decided to do all 4 units with zirconium dioxide, and I will show you how it works. Preparation, very smooth and very clean, very nice job from Andrea. And we scanned all the models, put them in the articulator, and you see the case now virtually, and we designed in full contour. And then after that, we reduced 0.3 millimeters to 0.4 millimeters in the 2 centrals. That's not a lot, but it's enough in this case. And if the machine is very good calibrated, you can get those sharp margins like this, and it's so nice to work with these copings because they fit really very well. I did an internal stain on these copings, and then after that I put some ceramic powder over it and fired it the first time. After that I did the first bake with very little dentin in the cervical area, a little bit mamelons and opal effect enamels, and covered all with 2 different kind of enamels. So that's the result of the first bake. After that I did the surface texture, and we made the try-in in the university, where I took some stains with me and took a look about how to even optimize the shade of these teeth. And that's the finished, these are the finished crowns on the model. And then it's very important to bond these crowns in the mouth. So you have to sandblast the inside of the crowns with aluminum oxide 50 microns with 1 bar pressure. And after that you have to put monobond plus on this. And there are a lot of studies, about 17 years, about these Maryland bridges, which are made of zirconium dioxide. It's from Professor Kern from Kiel in Germany, and he does bridges with this, successful over 17 years. So veneers and crowns will last forever if you do this bonding protocol. These are the bonded restorations in the mouth. They really look very nice. The cervical area of the reimplanted tooth looks different, but as you all know, this would be a really bad stuff to make here some operations to get the tissue even better than this. And when you see the patient smile, he doesn't show the cervical area of the tooth, so he's very happy with this result. It was a mess to get this picture, but we succeeded, and look how natural this all looks. And as you know, there is 1 veneer next to a crown. It's a really good result, and we are happy with this, and the patient even more. All right, so this was a front tooth restoration with Zolid FX in combination with some layering technique. Now I want to show you a huge case. It's not a all-on-4. In Germany, we don't do a lot all-on-4. We do more implants, and in this case, we did 24 on 16. So we did 24 teeth on 16 implants. Actually, the implants are made out of zirconium dioxide. It's a biological dentistry. And I did a peak structure in the upper jaw so that there is a little bit of flexibility on this very hard zirconium dioxide implants. And on this peak structure, I bonded full contoured Zolid FX crowns on in the lab. And the lower jaw is Zolid HT Plus because they are bridges. And I will show you this case now. Okay, this is the start point. The old reconstruction. He wasn't happy, the patient, and here you see the very white implants out of zirconium dioxide in the lower jaw. And that's the case I did. And this is solid FX, all the crowns you see in the upper jaw, and in the lower jaw, this is HT plus white in combination with infiltration technique before sintering, and here is some fired ceramics to get a good tissue. In the upper jaw, the tissue is composite because there is a peak structure under, and you can't fire it in the oven. All right, here a perfect shade match between FX and HT plus. Here the bridges, and here the single crowns. Here a nice anatomy with a little bit of torsion here. And that's interesting for you to see. These crowns are bonded on a peak structure. The peak structure I also milled with a motion 2 DNA, and I bonded these crowns on this peak structure. And we have now a little bit of flexibility, and the patient says after cementation it's a very nice feeling because it's not that hard. So this is the finished upper jaw, and this is the lower jaw and upper jaw together. And in the mouth you see the result, and looks nice, a good upper and lower shade matching. Patient is very happy. This is there are some cleaning channels where the patient can brush with some interdental brushes and clean it really nice. And occlusal side, and when he smiles he shows this, and he's very happy. He visited me in my lab and he's a very happy patient. All right. Veneer next to crown. I want to show you a case. I have to speed up a little bit. We have a few more cases to show. This is a case. A patient wasn't happy with his smile, and as you all see, you won't be happy too. So we did this case in the front, in the anterior area. Preparation from my buddy Michael, very smooth and very nice. So that's a perfect base where we can do a nice job. There's also implant in this area of the first premolar, and I did a titanium abutment and put some opaquer on it, and then did a full contour job from 1.3 to 2.5, and it's all thin, 0.6 millimeters in this area, but it works out very good with solid FX multilayer. I did not want to layer this case, so I milled out in full contour, made a nice anatomy, and then with Mio I did the color, and with Mio structure on the surface I put some glass on it, grinded the ceramic, and then my friend Michael cemented the crowns on the dies with a glass ionomer cement, and in the same way that I showed you on the case before, he bonded the veneers on it. And here's a little trick he used, as he took a pen and stained the inside of the veneer with this black color, and after that he went to the sand blaster with 1 bar pressure, 50 microns aluminium oxide, and cleaned the inside. And when the black color is away, he knows that he has that he made a good sandblast job on the inside of the veneer. So after that, Monobond Plus is applied, and then you can bond these veneers in with a bonding cement, with a dual curing composite, in this case Variolink veneer. So crown next to veneer, all made of zirconium dioxide, and a nice function with a lateral retrusion and protrusion, which is very important. And we close this case like this. Patient is happy, we are happy, and if you remember, this is the starting point, the baseline, and we reach this. Very good improvement for the patient. That's his smile now. Looks a lot better, I think. he's happy now, and we're happy too. All right, a big case I want to show you. Too is this one. This is our posteriors on implants. Actually 12 implants, Chemlock implants on the upper and lower posterior teeth. And this is a lot space for us to fill. As you see, it's mounted in the articulator, and there's a lot space. So you can't do this without reconstruction of gingiva. And we have a very good workflow with the CeraMill system to do this very smooth and very easy. These are the abutments I designed in my lab, and I milled them with the Motion 2 DNA. After that, I did some milling in my lab to get this very good surface structure, scanned it again, and then designed the hard and soft tissue. After that, I milled it, or in other words, the machine milled it for me in HD plus white. In this case, when we have to reconstruct the gingiva, it's good to take solid HD plus white, and it looks this way before we infiltrate some stain, and I will show you how to infiltrate this in a very fast way. I did a little video for you. So this is gingiva. It's a liquid called New Formula Gingiva from Aman Gilbach, and I placed this 4 times in the inside and outside of the gingiva area. Now the yellow stain is the A2. It is applied on the cervical area and on the occlusal area. On the incisal area of the posteriors, I took some A2 with dimmer liquid, and the green stuff is gray, and it looks like this before I put it in the oven. And directly after sintering, I get to this result. Here you see the sintering pearls are still over the bridge, and it looks in this way even smooth and nice, even before coloring. And I checked the occlusal and the function in the articulator, which looks like this. I reduced gingiva on my models, so I can do a better workflow on the model. I have some other models with the gingiva on. Don't be scared. So this is the other side, the posteriors on the other side, and then I do some color on it. In this case, it's also Mio, and you see the difference between before and after staining and before applicating the color masses. And this is the finished case here. You see the 4 bridges on the 12 implants, a nice emergence profile, and a very good occlusal concept is important for all those implant cases. And now this is the reconstruction of hard and soft tissue. And that's the finished case. Here on the lateral protrusion, we do some photos like this. And then I can show you a last case, and we're perfect in time, a few more minutes, and then we are finished. This is multiple tooth failure, I call this case. A very nice girl, but as you all see, there is one problem with her. She doesn't smile, and she doesn't smile because it looks like this when she smiles. It's a very big case because she did get some real huge surgery, some rearrangement of the upper and lower jaw. And they placed the jaws in a new position. She got some orthodontics, and she had some non-persistent tooth which had to be removed, and they put some implants in the University of Tübingen, and after 6 months took the impression. So I made the model job. As you all know, I like the Giroform model. Also in this case, I did these models and scanned them, designed the abutments. these are the abutments. I always make abutments with an opaque zirconium dioxide. In the most cases, I take Zolid ZE. In this case, I took HD plus and then bonded it on the titanium basis, scanned it again, and then designed the crowns on these abutments. There is one little bridge, and the rest is all single crowns. I milled it in solid FX multilayer and then made a little bit of layering from canine to canine in the upper and lower jaw to get a really very natural look. And a very good function is so important in these cases. So these are all the parts I designed and produced in my lab in a combination with my motion 2DNAs, which helped me a lot every day. And then I cleaned it, made a disinfection in the lab, and the dentist put all the abutments in, screwed them in, closed all the holes, and then bonded it all in. And now she smiles, and I'm connected with her in Facebook and Instagram, and it's so nice to see that she smiles and that her pictures now are not without showing any smile. She smiles and shows her very natural looking tooth, and I think she can show it really because yeah, it's looking natural and fits very well to her. So we did this case, and we finished this. Thank you very much for your time to join this webinar, and I hope you enjoyed it, and thank you very much.